So I think we're very well prepared if we're dealing with limited, isolated outbreaks. We've received a lot of information. We've got testing that we didn't have when the SARS virus made its appearance. So I think we're reasonably well prepared as long as it's isolated cases. Unfortunately, looking at the news from China, there is a suggestion that this might be expanding very quickly, and with a large number of cases, it will tax our ability to provide appropriate care to patients.
Now you have an interesting perspective because not only have you practiced medicine in Toronto, but you were there during the SARS crisis. How do we compare with Toronto when you get sort of outside that metro area?
I think Toronto, being directly affected by SARS, had a profound impact upon healthcare practitioners in Toronto that dealt with the SARS epidemic. We got a sense of what's involved to have an entire hospital quarantined, what's involved when a quarter of your healthcare staff are unable to come to work. We were able to set up dedicated emergency departments and isolate patients, but that was a trial and error process. And I think the lesson was learned very well in Toronto because they went through it. But having worked elsewhere in the country since SARS, I don't think other places in the country outside Toronto have that first-hand experience or really grasp the magnitude a large outbreak can have.
Are you seeing people coming in who think they may have the coronavirus? Has it hit that emergency room yet?
Fortunately, we haven't dealt with that yet. We are getting a lot of people with upper respiratory tract infections. It is the middle of flu season. We're very busy with that. And the tricky thing with this new coronavirus is that it presents very similarly to run-up-the-mill infections like influenza or other forms of the coronavirus, which most of us have had, that present with less severe symptoms than what we're seeing in the Hubei province outbreak.
From your perspective here in Vancouver, what's your message to the public?
I think the thing is, we're prepared for it. We aren't sure about how serious this is going to be in terms of spreading to Canada or the severity of the illness. A key thing to remember is initial reports tend to exaggerate the severity of these illnesses because only the sickest of the sick are getting tested for this virus. We don't have that sense, and we won't have it for months, as to the true level of danger posed by this virus, both in terms of how severe it is and in how far and how quickly it spreads.
And what about people out there, particularly at this time of year, the height potentially of flu season? How do people manage coping with their own symptoms or even potential symptoms?
I think there's two main things for people to keep in mind. If you have upper respiratory symptoms and they're in line with colds, influenza, and other respiratory viruses you've had yourself, unless you have travel history or a known exposure to somebody who's been exposed to the coronavirus or has traveled to central China, you should probably treat it as you normally would. If your symptoms are worse, if they're new, or in particular if you're experiencing significant shortness of breath, then that's a time that you should present to the hospital and get further investigations.
As I said, calm, measured advice. Dr. Curry, thank you very much.
Thank you, Ian.